Today, Millie has come in to be spayed. Now, it's a routine procedure, something that we do commonly here at Charter Vets, but this is usually what most of you clients see, just the consult room, and you don't know what happens after this point. Today, we just want to give you a step-by-step guide to what happens after this point and talk you through the operation. The first place patients go after leaving the consult room is the prep room. Here, smaller patients like Millie are placed on the tabletop where they will have an intravenous catheter placed. This catheter can be used to help us deliver drugs, and we can also give fluid support should it be required. We see the intravenous catheter as an essential part of a safe anaesthetic. We pride ourselves that all our patients receive one, and this is not something which is done at all veterinary practices. We will see Amy just secure the catheter now and flush it with saline to make sure it is flowing well. The next step would be to give Millie a pre-medication, or the pre-med. This is a combination of drugs used to relax Millie and also provide pain relief, both during the operation and in the recovery phase. Once this medication is on board, Millie can relax in her bed whilst it takes effect. Around 15 minutes later, we are able to induce anesthesia. A short-acting anesthetic agent is slowly injected intravenously. As we give this, we monitor Millie. She'll become sleepy, and her head will become heavy, and we gradually let her down on the table. By giving this, we are able to pass a tube into Millie's windpipe. It's this tube which allows us to deliver oxygen and anesthetic gases to Millie, and it's these which keep Millie under anaesthetic throughout the procedure. It also ensures that we have a protected and reliable access to the airway. This is very important, again, from a safety point of view. Millie has now been connected to the apparatus which delivers the anaesthetic gases. We also routinely use advanced monitoring equipment which Millie has been connected to. This equipment allows us to monitor the respiration, the heart rate, and oxygen levels in the blood. Nicola also keeps a close eye on the anaesthetic so we don't rely entirely on machinery. Once we are happy that Millie is in a safe and stable plane of anaesthesia, we begin to clip the hair away from the area we will be operating on. We do this so we can thoroughly clean the skin, and this reduces the risk of infection around the time of the operation. You'll also see that we have wrapped up Millie's legs in bubble wrap. We do this because smaller patients like Millie have an increased tendency to become hypothermic during an operation, and this simple step can help reduce this. Millie has now been moved through into the operating theatre. Whilst the nurse monitors the anaesthetic, the vet begins the process of scrubbing up. This is a very thorough process to make sure the hands and arms are as clean as possible before the operation. Just a small section of the process is shown here. After scrubbing up, the vet will go through into theatre and put on a single-use sterile gown. You'll also see the vet is wearing a hat and a mask. The vet will have also changed shoes before coming into theatre, as will the nurse. As you will have seen, the vet has cleaned his arms and his hands thoroughly, but he will still put on a pair of single-use surgical gloves for every single operation. This is just another step we take to decrease the risk of infection at the time of an operation. Millie's skin will have already been cleaned once out in the prep room, but just before surgery it gets a final prep in theatre. Again, we just show part of the process here. With the skin cleaned, we apply the surgical drape. Again, these are single use. In the operating theatre, we enjoy even more advanced anaesthetic monitoring equipment. This tells us a great deal of information, but we don't just rely on this. Again, you can see the nurse monitoring the depth of anaesthetic throughout and making sure that Millie is safe. Once we are happy that Millie is in a nice plane of anesthesia, we can think about operating. And that's where we're going to take a time out. The last thing we want is people passing out and fainting back home. So we're going to spare you the actual details of the surgery, and we'll pick up when we're closing the skin. Here you can see us just tying off the last knot after the skin has been closed. You can see the whole Spay procedure has taken place through a very small skin incision. At Charter Vets, we close up all our castrate wounds and our Spay sites with an intradermal skin pattern. This essentially means that no stitches will be seen on the surface. They will all be buried within the skin itself. You can see here that the knot is passed into the abdomen, and when the suture material is pulled tight, that last knot will disappear. Now this does look nice cosmetically, but it also gives dogs less to lick at and aggravate, and this again reduces the risk of infection. Well, that's a wrap, and Millie is allowed to go back into a kennel and sleep it all off, comfortable and happy with high-level pain relief on board.